Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you, everyone. Good morning. Welcome to our 32nd meeting of the year. It is Thursday, August 12th at 10 o'clock on the nose. We will begin with public comments. Your name and address for the record. You'll have 3 minutes. Terry, how are you? You got to say something. When you're in the audience, I know you want to speak.
Be the only one.
That's all right.
It's just baffles to me with, I'm reading the obituaries and people are dying from this COVID and they don't want to get the shot, they don't want to wear the mask. And it just baffles me. It's local. I see people, it's like due to complications from the COVID business. But on a happier note, don't forget for the Italian festival down in Warren, even though it's in Trumbull County, we're living in Mahoning County. And there's balloon rides somewhere in Ohio, I just read. It's open to the public. You could go on a balloon ride for $40. You could take a little plane ride for $80. So it's somewhere in Ohio.
You mean like those helium balloons?
Yeah.
I wouldn't get on a hot air balloon if you gave me $1 million.
There's one ride you go up 40 feet and then bring you down.
Yeah, you know what? Something that doesn't have any motor and doesn't have any attachment to the ground. I ain't gonna float around and,
Then you would never be a what do you call it? A explorer back in the 1500s. They have no motors.
No, I wouldn't be,
Go on a 40-foot.
Hey.
You're right.
I
You
pick and
fly, don't you,
choose.
David?
I can hang on to the ladder.
You fly, don't you?
Yeah. It's got a motor. It's got a motor and a
Sometimes they
steering
do.
wheel.
Sometimes they do.
Not some ball of fire that they, pull the lever.
Julie Garland got home on a balloon.
That's right.
Oh, Dorothy.
Oh, man.
Not me, I'm out.
Very.
I've done a lot of dumb things, but that ain't one of them.
It's not on your bucket list.
No balloon buckets on my list.
Anyone else? Troy, welcome.
Troy Rhodes from Ohio Edison First Energy, Canfield, Ohio. That's where I live. Just wanted, obviously, last night with the storms, we're continuing restoration throughout the day, yesterday into the evening and on through today. Just wanted to let the residents of Mahoning County know that when our utility men are out there working, please observe their safety areas and stuff like that. If they have any issues or concerns, really to use the contact line. With any questions, those are pretty dangerous areas out there. So if residents come up to approach those, we just want to warn them with some caution on that. We are expecting again, another storm again later on today. So we may see some more damage in the community. Just rest assured that we have crews out there and working on those. As far as general maintenance, we're continuing to do our distribution tree trimming throughout Mahoning County. That'll continue on in through September. As Commissioner Traficani and I did a little tour of the Poland area over there.
Yes, thank
We're
you.
going out there through those distribution lines through this cycle of the county. A lot of the work that's being done in Mahoning is sort of on the western end of Mahoning County. We did finish up parts of Youngstown and Struthers, but now we're going over into Sebring, Smith Township out and through that area over there. So just to let you know what's going on there. If there's any questions for me.
Troy, where did the storms hit here that were, I've heard everywhere, but where was it really the worst?
Traditionally on the west side of the county, Columbiana still has people out down there. Goshen was hit down through there. Lake Milton, Canfield was hit down there. Obviously, there was some storm issue there, but there was a major accident that occurred down there that brought a lot of people out. Fortunately, we were able to get all of them restored late last night with power. Up into Stark Lake, Marlboro, Hartville, they're still in 300, 400 numbers up there. Washington Township on the other side of Alliance hit pretty bad. Illuminating Company got hit pretty good up that way too. So that's where it is.
Troy, when there's an accident like happened in Canfield, you hear so often about, the metal making contact with electric lines and then the guy getting electrocuted inside or touching. Was that a situation where he had to remain like in the truck.
Yeah, it's still under investigation. I'm not quite sure what,
Yeah.
I do know that there was no reported injuries from that, just probably a lot of hurt feelings
Yeah,
as far as what went on out there, but as information is provided to me, I'll let you know. You do open up a question though, that First Energy is in the process, and hopefully in 2022, we'll be offering, it's called live wire training, and we'll be putting that out throughout the county. And I'll be working with the fire chiefs in Mahoney County to set up and coordinate these meetings where we'll actually bring in a live wire trailer demonstration where you literally plug it in and we demonstrate just the risks and the dangers of that electricity as it relates to first responders. What we'll be targeting through that situation is our fire, our police, and our public works people that deal with those. So I know I've worked with Chief Baird out at Green out there. We're hoping to still get one done here in 2021. We're gonna do it in October. I'm still trying to confirm that, but definitely in 2022, we'll be going throughout the Mahoney County, setting those types of opportunities up. Once we get those set up, I'll send an invitation out to you commissioners that you can come out and see that demonstration. But it's a very eye-opening experience to just see what that power can do, even in the event if you're wearing rubber boots, how to handle and conduct yourselves in those situations. But it was a great question, good lead in.
yeah, because we've seen so many times before in the past that, you know, they tell people stay away from downed wires and people get, you know, they get careless.
Yeah.
You know, and some of those, sometimes you've seen where a guy's sitting in a truck on a rubber seat or whatever and isn't affected and touches the truck itself that's got a charge to it and ends up killing them.
Or
You know.
they step out of
Step out.
out of that safe zone, as it's called.
You know, I remember at Youngstown Sheet and Tube, a guy went into a flooded basement to turn the pump on that kicked out and the pump was on and it was arcing and he got electrocuted and died in the water.
If you recall, I think it was roughly about 5 years ago, a Youngstown City police officer responded to an incident and that exact same thing happened. Fortunately, he survived.
Right, that
Right,
was a
but-
one-sided issue.
Yeah, but there is no doubt the danger out there. Our law enforcement friends out there in our fire department to respond to that. It's something to take very seriously, and I can't foot stomp them enough as the public works people, especially out in your rural communities where typically it's them that are there first when there's a down tree, and that down tree typically brings wires down. So to educate them on that. So that's our goal.
What do they say? Don't mess with something that can kill you that you can't see.
Correct.
Electricity,
Absolutely.
COVID,
It is.
you know, so.
Good lead into it.
See,
Yes.
that issue on the west side was a fire.
Yeah,
And at that time, that was years ago, they weren't taking their trucks home
all,
when they were on call and they couldn't get to them. So Chief O'Neill went in and he knew how to do it. He went in and did it. And then after that, we had a discussion with not you,
Mhm.
somebody else that was there. And they got to take their trucks home because you can't drive to PA to pick a truck up to come back all the way to the west side. Yeah, that was a miracle. That guy didn't get killed.
I am Chief O'Neill's who I'm working with as far as coordinating this for 2022.
Yeah,
So,
he is probably one of the best when it comes to understanding all the different entities.
yeah,
and
we
some
worked
of the
with him
securities.
as far as education out at the joint vocational school. We
Right.
donated some equipment so that he can use that out there at the fire school, for
Right,
lack of a better
right.
word for it out there. So yeah, Chief O'Neill's one of the best.
Yeah, he knows his stuff.
Troy, I had one more question. You know, you see like in neighborhoods that have the traditional telephone poles with the wires running up and down the street, then you have some communities that have underground service.
Gerard.
How does that work in a storm situation? What has better survivability, the underground wires or the poles?
Well, I guess the question, so no matter what, that underground service at some point is serviced by overhead lines. I live out in Canfield, down off of Herbert Road in Greenmont. That's all underground service. But up on Route 46 is where that power is coming from. So all it takes is a pole accident there to cause our power to go out
Everything.
underground. So it always comes from above is where that power comes in.
That's what God said.
Yeah, the power comes from above. Yes. And from a repair standpoint,
Yeah.
in all honesty, you have a quicker repair time above ground because you know exactly where
Yeah.
the damage is at. I think that's sometimes a misconception that if it's underground, it's, easier for everybody, not necessarily aesthetically, absolutely, but not necessarily for restoration.
Thank you.
Thank you very much.
Thank you, Troy. It's good having you.
Thank you.
Good info. Anyone else? We have both health departments on Zoom today. We have, is Ryan with
Oh,
us?
I thought
Yes.
that was that
Yes.
Lyle Tripp. Who's the guy that was married, that country singer to
She's there.
Julia Roberts or something? What was that guy's name?
Who?
Lyle Lovett? That's it. That's who that is down in the right corner, isn't it? That country singer, Lyle Lovett, or
Yeah.
Yeah, Dave, you don't even like country music, so I know you're not gonna know.
I only know because he's married to a pretty woman.
Oh,
There you go.
And we have Aaron Bishop. Guys, what we're gonna do you mind if we go through the agenda and then we're gonna defer to you at the end of the meeting?
I'm okay with that.
All right, thank you very, very much.
Thank you.
Did anyone else have anything else in the room here to say? No other public comments? Okay. None being said, I will ask for a motion to approve previous minutes of board meeting number 31 and approval of bills for
so
payment.
moved.
Roll call.
Commissioner Ditzler,
Yes.
Commissioner Remedy Agati,
Yes.
Commissioner Trafficant.
Yes, journal entry.
A motion to approve journal entry number 1.
Second.
Roll call.
Commissioner Ditzler.
Yes.
Commissioner Remedy Agati,
Yes.
Commissioner Trafficant.
Yes, agreements A through F, OMB grants. Anna.
Morning, Commissioners. This is an agreement with the Ohio Department of Rehabilitation and Corrections for the Justice Reincentive funding for fiscal year 2022 and 2023 in the amount of $187,352.
Hey, thank you, Anna. Recycling, Lou? He's here with us.
Commissioners, hi. These three items are, or these three communities are going to be in receipt of lease agreement monies to be hosting our drop-off recycling locations.
Thank you. Sanitary, Mr. Genetti.
Good morning, everybody. Letter C is an agreement with City Printing. This is for the printing services for the annual Pipelines newsletter. The estimated amount is $4,963.44. Non-general funds. Letter D is an agreement with 42 Inc. This is to provide the materials for the exhibit, assembly, support structure, transportation, removal, the display at the fairgrounds for the Canfield Fair this year. The amount is $3,539.54, also non-general. Letter E is an agreement with Pelton Environmental for the inspection and repair of 2 of our pumps at the Meander wastewater treatment plant. The estimated amount is $2,920, also non-general funds. And letter F is an agreement with Youngstown Letter Shop. This is for the mail finishing services for the Pipelines newsletter. The amount of $1,600, also non-general.
Thanks, Pat. Motion,
Motion to approve number 2, agreements A through F.
Second.
seconded by Dave. Roll call.
Commissioner Ditzler,
Yes.
Commissioner Remedy Agati,
Yes.
Commissioner Trafficant.
Yes, change orders 3A, OMB. Anna?
Good morning again. This is a change order number 2 with the city of, or Canfield Township, I'm sorry. To include resurfacing within the Township Hall parking area at no change in amount. Non-general.
Thanks, Anna. Motion,
Motion to approve number 3, change orders A.
Second.
seconded by Dave. Roll call.
Commissioner Ditzler,
Yes.
Commissioner Remedy Agati,
Yes.
Commissioner Trafficant.
Yes, resolutions, number 1.
Motion to approve resolutions number 1, additions.
Second.
Roll call.
Commissioner Ditzler,
Yes.
Commissioner Remedy Agati,
Yes.
Commissioner Trafficant.
Yes. Resolutions. Letter A. Audrey.
Commissioners, this is a resolution to accept the terms of the One Ohio subdivision settlement pursuant to the memorandum of understanding and consistent with the terms of the July 21st, 2021 National Opiate Settlement Agreement.
Thank you. Thank you, Audrey. Okay, continuum of care, Colleen Costa. She with us?
Yes.
Yes. Hi, good morning, Commissioners. This resolution is to accept the planning grant from Housing and Urban Development and to provide the required match from the general fund. The match is 25% and will be split with the city of Youngstown.
Good. Thank you, Colleen. Dog Ward. Diane.
Karen.
Good morning, Commissioners. Do you hear me?
Yes.
Diane's off today. She asked me to read this in. This is a resolution to approve the collective bargaining agreement with the Teamsters Local number 377. The agreement is effective from July 1st of this year through June 30th of 2024.
Thank you, Karen. Engineers, Pat?
Commissioners, letter D is resolution to approve the release of claims for the settlement of $493.56. This is to Joseph Barber for an incident at the intersection of South Avenue and Matthews Road on March 26th of this year. And letter E is the resolution of necessity to purchase a New Holland tractor. I'm not going to read through all the fancy name for that.
Wow.
This is through the state of Ohio Sourcewell Agricultural Equipment Contract in the amount of $60,003.18. This is the replacement of the tractor that was struck where one of my employees was injured on Bailey Road.
How's he doing?
He's good. Letter F, Human Resources.
You're on mute, Karen. Okay. You're back on mute.
Hear me now?
There you go.
Gotcha.
This is a resolution approving a wage reopener with the Communication Workers of America. The CWA in this unit represents microfilm, the employees of building regulations, and solid waste management.
Thank you. G and H.
Commissioners, letter G is a resolution providing for the ongoing disposal of obsolete, unfit property with the value of $2,500 or less per ORC 307-12 B1. This is scrap. And letter H is the resolution of necessity to purchase laboratory supplies, instruments, equipment, and installation services at 5 labs and renovations to the lab located at the Meander Wastewater Treatment Plant in the estimated amount of $150,000. This is under the state of Ohio purchasing contract.
Thank you. Glad you got that done. Sheriff. Jimmy.
This is a more obligation to Greenwood Chevrolet. We had an emergency repair for one of the sheriff's vehicles. It was brought to Greenwood because they were able to provide immediate service.
Very good. Thank you. Motion to approve resolutions A through J. Oh, I'm sorry, Jimmy.
No, Karen.
Karen's
Or
going to do this
Karen?
one.
Oh, okay. I don't.
She's muted again.
Okay, it says mute.
You're good. You're
So I'm
good.
opposite. Okay. Anyway, I'm reading this in for the sheriff. This is a resolution approving a letter of understanding with the Federal Order of Police, Ohio Labor Council, Inc., as part of a collective bargaining agreement with the Blue Unit.
Thank you very much. Okay, resolutions A through J.
All right, motion to approve number 2 resolutions A through J.
Second.
Seconded by Dave. Roll call.
Commissioner Ditzler,
Yes.
Commissioner Remedy Agati,
Yes.
Commissioner Trafficant.
Yes, thank you. Okay, now we're going to hear from both boards of health from the city of Youngstown. Erin Bishop, we'll let her go first, and then we have Ryan Tekak from Mahoning County Board of Health. Erin,
Yeah,
we need some updates. How you doing?
I'm good. How are you?
Good. Tell us what's going on with this COVID.
Yeah, so thank you all for having me today. Happy to kind of share with you just our trends. And this is, again, this is the city of Youngstown. So Ryan will share with you what's going on in the county after I'm done. But unfortunately, we have seen an increase in our daily incidence of our cases over the past several weeks. So on an average, where we are reporting about 28 new cases a week. This is double what we were seeing at the end of June. So on average, we're about 28 new cases a week. At the end of June, we were about at 12 a week. So we definitely are seeing this increase. Also, new infections are affecting the Black community at a rate of 1.4 times higher than the white community in Youngstown. So although we have not experienced case numbers as high as our surrounding jurisdictions, we are prepared for a surge as the Delta variant circulates throughout, you know, this area. So we really have been working with our team. It's called PCG. They're down through Columbus. They're doing all our contact tracing. So we've been working really closely with them and, you know, just kind of talking with them. And then also we are, you know, now it's time for schools to go back to school. So that's a big talk now on what we're going to do. And I think we've, you know, really stressed this and have talked on the news and have talked to, you know, the administration that we are not, you know, House Bill 22 took all of that, you know, put it on the health department. The health department can mandate us to wear masks. You know, we cannot do that no longer. And I think a lot of the schools are kind of waiting for us to come down and say, hey, you have to wear masks. That's not going to happen like it did in the past. But you know, we are following the guidelines of the CDC as well as ODH and, you know, the American Pediatric Association that are highly recommending the mask use for students in schools this year. So that is what, you know, we are expressing the importance to all of our schools to make sure that they're wearing the masks. But again, it is up to them, you know, it's up to their each jurisdiction on what they're going to do. So we can only highly recommend that people wear their masks, the students wear their masks, people wear their masks indoors when they're, you know, unable to be, you know, spread apart from people. And again, that, you know, the mask mandates aren't coming down like they did before. And so I think we, as, you know, our own jurisdictions need to make decisions on our own. Also, you know, we've been very busy with our COVID-19 clinics. We continue to have them almost daily at different places. We do have an open clinic every single day. If anyone wants to come Monday through Friday, 8 to 4, we are open here. They can come and get the vaccine. We also have been very busy going to all of the farmers markets. So they have a weekly farmers market here in the city of Youngstown. So like last week, we're at Jordan's Market. The one tomorrow was supposed to be on Federal Plaza and it did get canceled due to the weather. So they canceled it already today. But we were at YMHA yesterday doing more. We're at the YMCA this week. We'll be at the African American Male Wellness Walk, which is this Saturday. I know some of you have joined us in the past. This will be our 9th year doing the African American Wellness Walk. And so we're really encouraging people to come out and walk, as well as get the different screenings that Mercy Health will be offering. We will be offering the vaccines at the African American Wellness Walk as well. At the walk too, we are going to start our incentive program. So right now we have been incentivizing with $50 gift cards to Walmart. And these are for people that don't have insurance or for people that have private insurance. For people that are on the managed care plan, such as Molina or CareSource, they are eligible for a $100 Visa gift card. So we were doing, you know, the 50 just because we were worried that we weren't going to have enough money to do it. So we have now turned that into $100 gift cards. That'll start at the African American Wellness Walk. So that if they don't have insurance or if they have private insurance, they will get $100 Visa card, you know, from the city, or if they're on the managed care, they can get a $100 Visa card from the managed care plans. We also have offered an incentive for a voucher to go to the amphitheater. So we give them for one free lawn seat for any of the shows that are upcoming. They just return the voucher to the Covelli Center and then they in turn get a free lawn ticket. So, you know, some of the lawn seats are almost $70. So people can go away with almost $170 worth of, you know, incentives to try to get people vaccinated, because we still are, you know, really low. I mean, not low, we're less than half in the city of Youngstown, but we really, we break it down by zip codes, and, you know, the zip codes that we really want to, you know, hone in on and follow. I can just kind of go over them with you. So now this is for people that are fully vaccinated. So just to give you an example, in 44502, we have 31% people are fully vaccinated. 44503, 28%. 44504 says 87%, which you would think it is extremely high, But when Mercy Health Youngstown put their zip codes down, they actually put the zip code of the hospital. So we're working with ODH and with our Ohio Hospital Association to get that number changed, but it's been a couple weeks now, and it's still saying 87%, which is great, but that most of a lot of those people are from, the actual hospital that work there. 44505 is 39%, 44506 is 37%, 44507 is 29%, 44509 is 43%, 44510 is 35%, and then 44511 is 53%. So our total for the city of Youngstown vaccinated is 43.8%. And that is fully vaccinated, and for partially vaccinated is 47.9%. So those are the percentages for our zip codes in the city of Youngstown. And so that's why we have been setting up the different clinics throughout the community. I know we were doing a city park every Monday, and then also we have been working with, like last week, it's called a neighborhood improvement area. And we went in with our street department to do, in our parks department to do the lawns. We were going in and painting the fire hydrants, fixing signs, like stop signs that were crooked and doing all that kind of things. And then we all went door to door, and it was about a 3-street radius. And then we would knock on the doors and encourage people, and we set it up like right in the corner. It was right on Belmont Avenue. And, just kind of knocked on the doors, told them what we were going to be there. And then, so many times I think people think when you are in the neighborhoods, but you're at a church that's it's still 2 miles away, but this was actually, I could point like from their front porch, like, here, we're going to be right there at that blue tent. So we were hoping to get more people because we were going door to door. And, but we definitely starting to see an increase now. I think 2 things, incentives are important, as well as, people worrying about this Delta variant. I've definitely seen an increase of kids coming in to get vaccinated, but, we're there all around the community on, every day, somewhere different, or, we're here at the health department because it's, sometimes people like something just puts it like, I need to get it today. They don't want to wait, and so we want to get them while they're excited to get their shot so that they can, get vaccinated. And that's the big push right now is vaccinate. I encourage people in Mahoning County to get vaccinated. I encourage people that work in Mahoning County in the different divisions to encourage their employees to get vaccinated, because, we're still going to be doing the quarantining and, missing time off work and missing time off school if you're not vaccinated. So if you're vaccinated, you don't have to quarantine. And so I think that's another big incentive, is to say, like, who wants to be out of school again for 2 weeks, or who wants to miss a football game, or, a chance. I mean, you saw the Olympics, people that couldn't perform in the Olympics because they were not vaccinated. So
I wasn't able to perform.
What's that?
I wasn't able to perform.
I know. So that's really where we're at, is vaccination, and then to just continue to hopefully see an increase in the people in the city of Youngstown as well as Mahoning County. So I'm going to turn it, if you have any questions for me.
Aaron, let me ask you one thing.
Yeah.
When you were given the percentages of the city, do you have the city identified in those zip codes only? Because I know 44511 has a large percentage of Austintown.
Right,
Do
there
you
is.
have the whole zip code or just Youngstown?
So that is all of 44511. Yes.
Okay, so that includes a large portion of Austintown as well.
Aaron, have you seen the reoccurrence of somebody that already had the vaccination? What's the percentage of those people getting it to a lesser strain or whatever for people that are vaccinated? I mean, I know these are the ones that are not.
Right.
Us that are. What's that percentage you're seeing in the total that we're moving into that? Is there a large, or are there any?
So we personally at the Youngstown City Health Department have not had anyone that has been vaccinated to date that has gotten COVID-19. Now, again, that's just recently. It could change, but if you look, you know, even at the state level, it's, you know, 98% of the people that are getting COVID are not vaccinated. So the percentage is high. We haven't seen it here. We do track that. So we have the capability to find out if they're vaccinated or not, but we are not seeing it right now. I'm not saying that it isn't going to happen. And if it does, you know, we would share that, but we have not seen that here in the city of Youngstown.
Okay, another thing I want to say, you know, as we go all over the county, now that we're open, we're cautious of what we do. And of course, if the three of us need to wear a mask, we'll do that as well. But I hear people, which really upsets me, because I'm big on getting vaccinated. I'm big on wearing a mask if you don't feel safe in your environment or where you're going to go. I don't say you have to not do anything, but just be aware of your surroundings. I hear people tell me I'm getting bad information, that the medical people at different hospitals are telling them they're not getting vaccinated because they don't feel it's safe, and that this is just a coup, and that we are overreacting. So my response to a few of those people was overreaction. I could use myself as an example and my family. And I says, is that overreacting to a situation? Well, that was way back when. I said, that doesn't mean anything. It was here. There have been people that have died that we all know. So I said, I don't understand where your medical degree has come from and why aren't we listening to the CDC? Now, I know you're hearing the same thing in the city because I'm hearing it. And that needs to change. Somebody, I mean, I don't know if people at St. E's, the nurses, or any of these other Stewart or any of these other places are telling people that they're not getting vaccinated. They shouldn't be made to do this. They don't want to put a foreign entity in their body. Really? I mean, I could kind of go off on that, but I mean, have you heard this?
Oh, yes, Carol. So I hear it a lot on a daily basis, you know, especially when I have parents calling me and saying, I really want to get my kid vaccinated before they go back to school, but my pediatrician's telling me I shouldn't. I'm like, ah. And, you know, or I have, you know, staff that are calling, you know, throughout the city saying, well, my family practice physician, they're telling me not to get the vaccine. So I think part of this has to do with, you know, people put their personal opinions into this, you know, and we see it all around where people are putting their personal feelings toward this. And that's why, as the health commissioner, you know, I do follow the guidance of the CDC. Do I agree with some of the things sometimes? Probably not. You know what I mean? There are different things, you know, 'cause I'm a human being, but at the end of the day, I truly follow the guidance of the CDC, and then therefore express and tell everybody else to, you know, to follow that guidance. So this is where we are at now. And when this, you know, if the CDC were to say, you know, some of the things that they said in the beginning, where I was like, hey, we should do this. But at the end of the day, you know, we follow the science, we follow the data, and we continue to, you know, just to keep, our goal is to keep people safe and keep people healthy. And I think, you know, we did a good job of it here in Mahoning County. You know, I still think about, I know many people that had it very, you know, were sick in the hospital. I've had people that passed away from, you know, family member that passed away from COVID. So yeah, for me, it is really real. And so I do get frustrated, but I just have to always keep the hat on as I'm the health commissioner. We follow the CDC, we follow ODH, and we follow, you know, the medical experts. But it's hard when your doctor is telling you.
Why? I don't get that. I really don't understand that at all. Do you?
No.
I know you can't really say, but I don't get it.
Nope.
I'm sorry, I get very passionate about this.
For hours.
I know, but you know, the reason they're here today is because people need to hear that they need to, I mean, we don't need to drive it home. I don't know.
Aaron, I had a question. I got to thank you for those wonderful statistics. And obviously you have your pulse, you, the city, what's going on in your communities, and you're making it very accessible for everybody. So there really is no excuse to not get it. But you mentioned earlier, you gave us a percentage, 43.8 of fully vaccinated individuals in the city. Then you said partially vaccinated. Are those the ones that just had the one shot and waiting for a second?
Correct. So those are the people that just had one shot. And so they're waiting. So hopefully those are just people that kind of came in, but you do worry because maybe they didn't get the second shot. There were people that might have gotten sick and were afraid to get that second shot. But I know this week alone, I had 2 people that didn't get their shot because they got so sick, but now they're really worried about the second shot, I should say. Now they're really worried about the Delta variant. So they came back in and got their second shot. So I think there was people that didn't get that second shot, especially if they were sick, and then there were people that just, were like, I'm just not doing it. So, but that's where you see that the difference in the one shot versus the fully vaccinated, meaning they got both doses.
We thank you very much, Aaron, for your time.
Thank you.
And for all the hard work that you and your department have put into this and tackling this pandemic and continue to tackle this pandemic. And we thank you so much for your time today.
Thank you.
Okay. Now we'll defer to Ryan Tekak, Mahoning County Health Commissioner. Ryan?
Commissioner Trafficani and commissioners, thank you for having me. A lot of the stuff you will hear will probably almost be a repeat. Aaron and I, we basically stay unified in our approach. But to address Carol's answer about vaccine breakthrough cases, the Ohio Department of Health, actually, there's a dashboard currently now on their website where they're tracking vaccine breakthrough cases. And as of since January 1st, 2021, COVID-19 hospitalizations among fully vaccinated individuals in Ohio stands at 295. Individuals that are fully vaccinated according to deaths as well to COVID is 64. So those are your COVID vaccine breakthrough cases, people who are fully vaccinated.
That's not.
What we're currently hearing with the Delta variant, it's more contagious than the previous variants. It's spreading rapidly. The good news is the current vaccines currently are showing that they're effective against the Delta variant. The bad news is individuals who are not vaccinated are currently at an extreme risk to contract the Delta variant and more at risk for serious illness, hospitalizations, and/or deaths. In Mahoning County, looking at our case counts. So the last time that I was on here, I was pulling different weeks. So from July 19th through July 26th, we saw 103 positive cases. Average per day was 14. July 27th through August 2nd, 142 cases. Average per day was 20. Going from August 3rd through August 9th, 167 cases. You can see we're trending upwards in positive cases. And average per day was 24. So that's a 20% increase from last week to this week when we pulled the number for positive cases. In terms of vaccination rates, Mahoning County stands at 48.6% of individuals who have at least started one dose of the vaccine. Ohio's currently at 50%, a little bit over 50.25. We also continue to work with our local school systems. And as Aaron has stated, we support full in-person healthy learning, encouraging districts to adhere to the CDC guidance for universal masking within the schools. However, understanding that the schools now have to make that decision. Senate Bill 22 has really restricted the Ohio Department of Health, the governor, and your local health departments to mandate masking. What we do is we provide science-based and data-driven decisions or guidance to the local schools, and we'll continue to do that on a weekly basis here in Mahoning County. Our clinics continue to be held here at our office, 50 Westchester. We currently have a clinic going on today, Thursday. We have them every Thursday, and we're starting to see an increase in vaccinations. On average, we're getting about 30 individuals who are now either scheduling or walking through the doors to receive a vaccine, where 2 or 3 weeks ago, we were only seeing maybe a handful, if that. I mentioned last time that we were talking about offering vaccinations at the Canfield Fair. We have worked with the Canfield Fair administration, and the Fair Board has agreed and they're pleased to have us out there offering vaccinations. We will be out in the Austin Town building from on these dates. So 9/2, 9/3, 9/4, and 9/5 from 5 to 8 p.m. offering vaccinations. Also, we're having discussions about incentives here at our health department. We fully haven't implemented that yet, but we are having those discussions amongst our leadership team as well as amongst our board members. And we are also considering potentially offering incentives for individuals who are going to at least receive 1 dose of the vaccination. A lot of what you're hearing throughout the state is you can go no higher than a $100 Visa gift card or some type of incentive that's a gift card to Giant Eagle or elsewhere. So you may see that in the future here at Mahoning County Public Health, just depending on where the funds are going to come from. The Ohio Department of Health, Governor DeWine has asked local health departments to potentially try those incentives to see if they actually increase vaccination rates within counties. So that's why we're thinking about that. Other than that, I would like to thank the county commissioners always for the support that you give to our county health department. Without you guys, we wouldn't be able to do some of the things that we do. So once again, I thank you, and I'd be more than happy to come back next week for a report.
Hey, Ryan, I heard on the news last night, the national news, that they have a booster shot coming out. And they're going to put high-risk people first to get it. Is it something that you think will be recommended for everyone to try and get? Because if there's a booster going on, I want to get one.
Yeah, me too.
Yeah, that's a lot of good questions. I mean, we haven't received that information. I think a lot of what you're hearing is what's coming out of either like Pfizer or Moderna, saying that a booster shot would potentially be recommended for those who are either elderly or have some type of immune disorder. But as soon as we get information that'll be passed down through the state, we would get that out to you of when and where boosters would be available.
You heard anything about people just getting another shot of, like, say I got 2 of Moderna and I went and got another Moderna? So I saw that people, that one woman got 9 shots. You know, I mean, obviously no one recommends that, but remember they gave her a dose of a whole vial that had 9 of them in it?
God.
And she received somebody made a mistake and gave her the whole bottle instead of just
Oh
1/9
my
of it.
God. She had a big.
And there was no negative, reaction from it.
Thank God.
But is that something that you hear any medical information about, that it's just like getting one of the Modernas over again, or is it a different different dosage?
It shouldn't be happening. At least I can speak for Ohio. So all your vaccine providers use a system called ImpactSys. So anytime that you receive a vaccination, that needs to be uploaded into ImpactSys. And then as an individual comes into our health department, especially now, and they want to be vaccinated, we cross-reference with ImpactSys to see if they were already vaccinated. And if so, they need to be turned away because the emergency use authorization does not allow for essentially what you're saying is a booster shot to be received.
Gotcha.
How's that little Cleveland Browns fan doing? Is he growing up big and strong?
He's growing up big and strong, and like I said, he's not going to be a Cleveland Browns fan. I'll disown him.
We'll take him then, Ryan. When he grows up to be a Cleveland Browns fan, you could drop him off at our house.
No, he's getting big for sure. He's actually 2 months today, so 8 weeks.
Nice.
Appreciate you asking. Definitely, thank you.
Audrey.
Ryan,
Yes.
talking with the metro counties, they had talked about House Bill 248. That's talking about putting a little bit more restrictions on people being able to require their employees to get vaccinations. Can you know anything about that, or can you speak on that?
Is it House Bill 244 maybe is what you're referring to?
If that's
Potentially.
what it is, if that's what it is. I think it's 248 though.
Is it the one where they're saying that the vaccine needs to have full FDA approval by October 16th before you can, I don't want to use the word discriminate, but discriminate against individuals who are vaccinated and not in wearing masks? If that's the same House bill that you're discussing, I believe to make it simple, if the vaccine does not have FDA approval by, it's either October 13th or October 16th, businesses and or like schools wouldn't be able to say unvaccinated individuals within the school system need to wear a mask. So
None of them,
None of them
Yeah.
are approved,
they're not fully
FDA
approved.
approved.
They're not.
they don't have full, yeah, they don't have full FDA approval. They're right now under emergency use authorization.
Okay, which
Yeah.
means they probably all get it.
Right, so
Depends
that
on who's
basically,
paying.
if any of the agencies or governments want to mandate any of their employees, they can't at that point in time, or they can't discriminate, right?
I believe I would have to go into it and fully read it and
Wouldn't that
probably,
who that was? If it's us, we couldn't, but I think if it were the court system, it'd be a whole nother ballgame.
And the ACLU might step in.
Oh, yeah.
All right, I'll forward you that, Bill.
okay, appreciate that.
You guys good?
Yep.
All right, Ryan, thank you again very much.
As always, thank you.
Maybe next week, okay?
For sure, just
All right.
give me a heads up.
Thank you, sir.
I'll see you. Thank you.
Okay, before closing out, is for the good of the order, any elected officials or department heads would like to comment? Lou?
Commissioners, I just want to let you know, we had our policy committee meeting on Monday, and one of the things discussed was our friends from Stymie Road. And we are making a proposal to address the situation out there as far as the condition of the road. And we are working in partnership with Public Services, who's agreed to come in half. We'll be able to finalize that when we finalize our budget back in or in October.
Thank you.
Yeah,
Thank you.
thank you.
Expanding on that, the scale unit went out Sunday evening from 8 o'clock till midnight, caught 0 trucks. So that was one of the issues that I know the Poland Township Police Chief and our sheriff have said, they can't sit there 24 hours a day in the hopes that a truck's going to drive through.
Thank you for addressing it. Thank you, Lou, too. Anyone else? Audrey? No, she can't
She's
hear.
muted.
You're muted.
No?
Okay, I don't know, are you talking Audrey Tillis, Audrey Morales?
Audrey M.
Audrey Morales, no, nothing new, and I thank you commissioners for all you do, Audrey, Nancy, and we're fine at JFS today.
Okay, thank you. All right, anyone else? No? Carol? Dave?
Well, I just have to, you know, I end every meeting with that, have a safe weekend, enjoy yourself, be safe. But I always have to end all these meetings with my opinion. And my opinion is, if our employees are not vaccinated, please get the vaccination, be safe. I know there are so many different things out there that are on the website, doctors' sites that are saying, you know, don't do this and it's gonna bother you in this respect. But I don't believe that to be completely true, but then that's my opinion. I think you need to keep yourself safe. If you don't feel safe, wear your mask. No one's gonna say anything, even in county government. You wanna wear a mask to work, you do what you feel's best for you. But my encouragement would be to get the vaccination. There are so many places, like Aaron and Ryan said, you could go walk over to City Hall right now and she'll give it to you. I mean, not City Hall, but the Board of Health in the city, which is right across the street. So I'm gonna keep saying that. I know some people get a little offended when I do that, but I have to say things that are in my heart and in my opinion. And I'm gonna do it every meeting. Until every single person in this county gets vaccinated. I'm sorry. I'm gonna be diligent. We've all seen one side of it. And we've all seen the other side where you've had illness, deaths, and it's not a pretty sight. So I'm done. Thank you. I'm
Okay.
off my soapbox now. Have a nice weekend. Please be safe. Go to Trumbull County to go to the fair. Italian Fest out there. Ours was very successful last weekend. We had great weather. Wow had a very nice event for the kids and for their fundraiser over here. It was a wonderful event. Oh, it was great.
David.
Yeah, I mean, I agree with Carol. I think that, I just have to kind of shake my head when I hear people talking about whether they get the shot or don't get the shot, I mean, to me, I'm not a doctor, but you follow the science. You just look at the numbers. 98, 99% of the people that are in the hospital, dealing with COVID that have been hospitalized are unvaccinated. I mean, what does that tell you? I mean, it's, there's so much conspiracy theorist type situations out there where, you just step back, whether it's election results or whether it's COVID or, everybody has these things and, so, everybody do your own thing and, follow your own lead, but, it's something that, I'm not an expert on, so I rely on the experts and I follow the experts. One of the things I did want to make mention is we always talk about, like Troy was talking about accidents and, and situations with electricity. And I always say, I grew up, working in Youngstown, right out of high school, Youngstown Sheet and Tube. And something that really kind of brought back memories. The other day on Facebook, Rosian, Anthony Rosian, I knew Nicky Rosian from down the mill, might have been his brother, or maybe that's his nickname, Nicky. But he posted on there that it was 41 years ago, this past Wednesday, or past Tuesday, I'm sorry, 2 days ago, that a young man named Ron Kessler was killed at Youngstown Sheet and Tube in an accident, an industrial accident at the piercing mill in the Siemens hot mill. And I'll never forget, I was working there that day when it happened. And when the ambulances came in and everything, and he was crushed in a just a terrible situation and setting. And he was, I believe Ron was like 28 years old. And at the time I was probably 21 or 22. And, you just look back and you think, the things that happened that we took for granted, or doing things we take for granted, whether they be in an industrial setting. And thank God that today there's not as many people killed as there was back then. But 40 years ago, when I worked at Youngstown Sheet and Tube, during the time frame I worked there, I think 3 or 4 people were killed. Somebody, there was an accident almost annually where that situation happened. And, we look today and thank God that, we have OSHA and we have so many regulations, we have different things. And I know Troy deals with them on a regular basis because, things you can't see that can kill you. And I quit, changing the breakers and the wires without pulling the main off anymore, after I got 2 screwdrivers welded to the back of my electric box, and knocked on my butt, the things that you do when you're younger, that we don't do today and hopefully don't do today. So just wanted to say that, I was remembering Ron Kessler's family this week, 41 years ago, since a young man got killed in a terrible accident. And, and just make sure that you watch out for your friends, your neighbors, your families, because life changes in the blink of an eye.
How true is that?
Thank you, Dave. And I agree with Carol and Dave. I mean, it's personal responsibility. I mean, you have to figure your life's worth something. I don't know why anybody would not go get the shot. And I'm going to say it again, like Carol does. I was a holdout. I wouldn't do it, thought I was invincible. I take vitamins, I walk every day, nothing's going to happen. I made it through. And then when I started hearing about the reoccurring cases, that's when I got my butt in gear and I went and got the shot. And I said, why didn't I just do this months ago? And now I feel comfortable that I could go out and be among people. So again, it's personal responsibility. If you feel for your life, you shouldn't have to be encouraged to go do it on your own. Very simple. And we had a nice time at the Italian Fest Friday night, a lot of people, and then the house band closed it out on Sunday night downtown, and they just draw people like you wouldn't believe, and it was wall to wall. So that was fun, and look forward to the Briar Hill Fest coming up in a week or so. So with that being said, Nancy, our next meeting,
It's next Thursday right here.
all righty, motion,
Motion to adjourn.
Second,
roll call.
Commissioner Ditzler?
yes.
Commissioner Remedy Agati?
Yes.
Commissioner Trafficant?
Yes, thank you, everyone.
I love the whole.
Brian, behave.